The fluorescent lights hummed overhead in St. Catherine's Medical Center as Margaret Chun adjusted her worn scrubs for what she knew would be another grueling 12-hour shift. At 68, she moved with the careful precision of someone whose body had served 4 decades in the medical field. Yet her eyes still held the sharp intelligence that had once made her one of the most respected nurses in the city. But that was before the scandal that destroyed her reputation, before she lost everything. Now, she was just another aging nurse working the early morning shift, invisible to most of the younger staff who whispered behind her back. They didn't know her story. They didn't know that she once ran the cardiac unit at the most prestigious hospital in the state, or that she had pioneered several patient care protocols that were still used today. Dr. Richard Blackwood burst through the doors of the emergency department like a storm cloud, his expensive shoes clicking against the polished floor. At 35, he was everything Margaret had once been: respected, feared, and absolutely certain of his own importance. His designer watch caught the light as he grabbed a chart from the nurse's station, barely acknowledging Margaret's presence. "Room 304 needs immediate attention," Margaret said quietly, approaching him with the dignity that years of experience had taught her to maintain, even in the face of disrespect. Dr. Blackwood looked up from his chart, his eyes narrowing with barely concealed irritation. "I'll decide what needs immediate attention, nurse. Perhaps if you spent less time giving unsolicited advice and more time doing your actual job, this department might run more efficiently." Margaret felt the familiar sting of humiliation, but she pressed on. The patient in 304 was showing signs that troubled her, signs that her decades of experience told her were serious. "Doctor, I've been monitoring Mrs. Rodriguez for the past hour, and her symptoms suggest—" "What they suggest," Dr. Blackwood interrupted, his voice rising enough for nearby staff to turn and stare, "is that you don't understand your role here. You take vitals. You change sheets. You follow orders. You don't diagnose patients." The emergency department fell silent, except for the steady beeping of monitors and the distant sound of someone crying in one of the rooms. Margaret felt every eye in the room on her, felt the familiar burn of shame creeping up her neck. What none of them knew was that the patient in room 304 had been listening to every word. Elena Rodriguez lay in the hospital bed, her silver hair spread across the pillow like a halo. To anyone who looked at her, she appeared to be just another elderly woman in the emergency room, perhaps someone's grandmother brought in for chest pains or a fall. Her clothes were simple, her jewelry minimal, and she had arrived alone in a taxi, clutching a worn purse. But appearances, as Margaret Chin knew all too well, could be devastatingly deceiving. Elena had built her first company at 25 with nothing but a fierce intelligence and an unshakable belief that respect was earned, not given. By 40, she controlled a business empire that spanned 3 continents. By 60, she was one of the most powerful women in the medical industry, sitting on the boards of 12 major hospitals and controlling a foundation that had donated over $2 billion to medical research and education. At 71, she still commanded rooms with a single look, still made decisions that affected thousands of lives, and still remembered every slight, every act of kindness, and every moment when someone's true character was revealed. She had come to St. Catherine's that morning not because it was the closest hospital to her penthouse apartment, but because she had heard disturbing reports about the treatment of staff and patients. As the largest single donor to the hospital's research wing and the person whose foundation provided 40% of the institution's annual funding, she felt it was her responsibility to see things for herself. She had not expected to witness such a public humiliation of a nurse who was clearly knowledgeable and concerned about her patients. She had certainly not expected to feel her chest tighten with genuine medical concern as the stress of watching the interaction affected her already fragile heart. But most of all, she had not expected to recognize the nurse being humiliated. Margaret Chun, the same Margaret Chun who had saved her grandson's life 15 years ago when every other medical professional had given up hope. The same Margaret Chun who had worked 18-hour shifts for 3 weeks straight, monitoring Jake's condition, adjusting his care, and refusing to accept that a 12-year-old boy should die from complications that others called unavoidable. Elena remembered every detail of those terrible weeks when Jake lay in the pediatric ICU, his small body fighting against the infection that had ravaged his system after a routine surgery went wrong. She remembered how Margaret had noticed a subtle change in his breathing patterns that the doctors had missed, how she had advocated fiercely for additional tests that revealed a rare secondary infection, and how she had personally overseen the complex antibiotic regimen that ultimately saved his life. She also remembered the scandal that followed, the accusations of medication errors that Margaret had supposedly made on another patient, the investigation that found irregularities in her record-keeping, the quiet resignation that came with whispered suggestions of age-related incompetence. Elena had followed the case privately, using her resources to investigate what had really happened. What she discovered had made her sick with rage and sadness. Margaret had been framed by a colleague who resented her influence and expertise, set up to take the fall for errors she had never made. By the time Elena's private investigators uncovered the truth, Margaret had already been destroyed professionally. The colleague who had framed her had moved on to another hospital, and the administrators who had failed to properly investigate were covering their tracks. Elena had tried to find Margaret then, to make things right, to offer her the respect and position she deserved. But Margaret had disappeared, leaving the city and apparently the profession that had been her life. Now, here she was, still nursing, still caring for patients, still trying to do the right thing despite everything that had been taken from her. And here was another doctor, another man who thought his title gave him the right to humiliate someone who had forgotten more about patient care than he would ever learn. Elena pressed the call button beside her bed. It was time to remind everyone in this hospital exactly who held the real power. Dr. Blackwood's public dressing down of Margaret was far from over. Emboldened by the silent audience of nurses, residents, and medical students who had gathered to witness the spectacle, he launched into what could only be described as a masterclass in professional cruelty. In fact, he continued, his voice carrying across the emergency department with the confidence of someone who believed he was untouchable, I think this is an excellent teaching moment for everyone here. Margaret stood frozen, her hands clasped in front of her, as Dr. Blackwood began to pace like a prosecutor delivering a closing argument. The younger nurses looked uncomfortable, some staring at their shoes, others stealing glances at Margaret with expressions of sympathy and embarrassment. This is what happens when hospitals lower their standards, Dr. Blackwood announced, gesturing toward Margaret as if she were an exhibit in a museum. When we keep nurses past their prime, when we allow outdated thinking to influence modern medicine. This woman probably learned her techniques when doctors still made house calls and nurses were expected to be silent assistants. A resident named Dr. Sarah Kim shifted uncomfortably near the nurse's station. She had worked with Margaret on several cases and had been consistently impressed by the older nurse's knowledge and intuition. But challenging Dr. Blackwood was career suicide for someone still in training. Perhaps, Dr. Blackwood continued, warming to his theme, it's time for some of our more experienced staff to consider whether they're truly serving patients or simply clinging to jobs they're no longer qualified to perform. Margaret's face had gone pale, but her posture remained straight. In her 4 decades of nursing, she had faced plenty of difficult doctors, plenty of professional challenges, and plenty of moments when her gender, her age, or her race had made her a target. But this felt different. This felt like a public execution. Now, Dr. Blackwood said, turning toward room 304, let me show you how a real medical assessment is conducted. He pushed open the door to Elena's room without knocking, his entourage of residents and students following behind him like baby ducks. Margaret hesitated for a moment, then followed at a distance, her nursing instincts overriding her humiliation. If the patient in 304 was in danger, she would not abandon her duty, no matter the personal cost. Dr. Blackwood approached Elena's bed with the casual confidence of someone accustomed to being the smartest person in the room. Elena, still appearing to be nothing more than a concerned elderly patient, looked up at him with what seemed like gentle anxiety. Mrs. Rodriguez, Dr. Blackwood said, barely glancing at her chart. "I understand you've been having some chest discomfort. Let me assure you that despite what some of our staff might have suggested, there's probably nothing to worry about. These things are usually just anxiety or indigestion in women of your age." Elena's eyes flickered almost imperceptibly toward Margaret, who stood near the doorway. Margaret caught the look and felt a strange jolt of recognition, though she couldn't quite place it. However, Dr. Blackwood continued, "We'll run a few routine tests to put your mind at ease. Nothing as dramatic as our overzealous nursing staff might suggest." He began a perfunctory examination, his movements quick and dismissive. Elena submitted to the exam quietly, but her eyes never stopped moving, cataloging every face, every expression, every reaction in the room. Margaret watched from the doorway, her trained eye noting details that Dr. Blackwood was missing in his haste to prove his point. The slight bluish tint around Elena's lips, the way she favored her left arm, the subtle changes in her breathing pattern that suggested something far more serious than anxiety. "As I thought," Dr. Blackwood announced after his brief examination, "classic anxiety presentation. We'll give you something to calm your nerves and have you discharged within the hour." Elena smiled weakly. "Thank you, doctor. You've been very educational." Dr. Blackwood preened at what he took as a compliment, completely missing the steel beneath Elena's soft words. As the group filed out of the room, Elena caught Margaret's eye and mouthed a single word, "Stay." Margaret looked around nervously, but the hallway was empty. She slipped back into Elena's room, closing the door quietly behind her. "You don't remember me, do you?" Elena asked softly, her voice suddenly stronger and more commanding than it had been during Dr. Blackwood's examination. Margaret approached the bed cautiously, studying Elena's face with the intensity of someone trying to solve a puzzle. There was something familiar about the eyes, something in the set of the jaw that tugged at her memory. "Should I?" Margaret asked, her professional instincts still focused on Elena's medical condition despite the strange turn the conversation had taken. Elena smiled, and suddenly the years seemed to fall away from her face. "Jake Martinez, Pediatric ICU, St. Vincent's Hospital, 15 years ago." The recognition hit Margaret like a physical blow. Her hand flew to her chest as the memories came flooding back. A 12-year-old boy, fighting for his life after complications from what should have been routine surgery. 3 weeks of round-the-clock care. A grandmother who never left his side, who held his hand during the worst moments, and whose eyes had reflected both terror and desperate hope. "Mrs. Martinez," Margaret whispered, then caught herself. "Elena Rodriguez Martinez." "Just Elena," the older woman said, her voice warm now. "And Jake is 27 now. He's a doctor himself, thanks to you." Margaret felt tears stinging her eyes. Jake had been one of her greatest successes, one of the cases that had reminded her why she had chosen nursing in the first place. She had fought for him when everyone else was ready to give up, had noticed the subtle signs that led to the correct diagnosis, had personally monitored every aspect of his care. "How is he?" Margaret asked, momentarily forgetting where they were and why she was supposed to be afraid. "Brilliant. Compassionate. Everything a doctor should be," Elena said. "He's completing his residency in pediatric cardiology. He says he chose that specialty because of a nurse who taught him that healing isn't just about medicine. It's about refusing to give up on people." Margaret was crying now, the stress of the morning and the unexpected joy of this moment overwhelming her usual composure. "I look for you," Elena continued, her voice gentle but urgent. "After what happened at your previous hospital, I knew you were innocent. I had it investigated." Margaret's head snapped up. "What?" "Dr. Patricia Williams. She was the one who altered your records, who made it look like you had made medication errors. She was jealous of your reputation, your relationship with patients and families. She thought destroying you would clear her path to the head nurse position." The room seemed to spin around Margaret. The scandal that had destroyed her career, that had forced her to leave everything she had built, that had reduced her to working entry-level positions at hospitals where no one knew her history. It had all been a lie. "I have proof," Elena said quietly. "I've had it for years. I was going to use it to clear your name, to get you reinstated, but you disappeared. I've been looking for you ever since." Margaret sank into the chair beside Elena's bed, her mind reeling. 15 years of shame, 15 years of believing that maybe she really was losing her edge, maybe she really wasn't competent anymore, all based on a lie. But even through her shock, her nursing instincts remained sharp. She noticed that Elena's breathing had become more labored during their conversation. Noticed the way she was unconsciously rubbing her chest. "Elena," Margaret said, her voice suddenly professional again, "you're having cardiac symptoms. Real ones. That doctor was wrong." Elena nodded grimly. "I know. I've been having chest pain for the past 3 hours. It's getting worse. Why didn't you say something?" Elena's smile was grim. "Because I wanted to see how this played out. I wanted to see exactly what kind of doctor would humiliate a nurse who was trying to help a patient. I wanted to see what kind of man would put his ego above medical care." Margaret was already moving, checking Elena's pulse, noting the irregularity, the weakness. "I need to get you to cardiac ICU immediately. This is serious." "I know," Elena said calmly. "But first, I need you to understand something. I'm not just Jake's grandmother. I'm Elena Rodriguez Martinez, and I control more of this hospital than Dr. Blackwood could ever imagine." Margaret paused in her assessment. Elena Rodriguez Martinez. The name was familiar from hospital newsletters, from fundraising announcements, from the plaques on the walls of the research wing. "You're the Elena Rodriguez Martinez." The foundation. The research grants, the new equipment, the salaries of half the staff, including Dr. Blackwood, Elena confirmed. "And as of about 15 minutes ago, I'm also the person who's going to make sure that what just happened to you in that hallway never happens to another nurse in this hospital." Margaret felt a chill that had nothing to do with the hospital's air conditioning. "What are you planning?" Elena's smile was sharp as a blade. "Justice. For you. For every nurse who's been treated like a servant instead of a professional, and for every patient whose care has been compromised by ego and arrogance." She reached for the call button again. "But first, let's see how Dr. Blackwood handles a real medical emergency." The call light above room 304 began flashing urgently, accompanied by the insistent beeping that every medical professional recognized as a priority signal. Within seconds, footsteps could be heard rushing down the hallway. Dr. Blackwood arrived first, slightly out of breath and clearly annoyed to be pulled away from what he had assumed would be a routine discharge. He pushed open the door to find Margaret at Elena's bedside, efficiently checking vital signs and preparing emergency medications. "What's the meaning of this?" Dr. Blackwood demanded. "I told you this patient was stable." Margaret looked up from the cardiac monitor, her voice steady and professional despite the gravity of the situation. "Mrs. Rodriguez is experiencing acute cardiac distress. Her blood pressure has dropped to 90/60. Her heart rate is irregular at 45 beats per minute, and she's showing signs of decreased cardiac output." Dr. Blackwood strode to the bedside, pushing Margaret aside. "That's impossible. I examined her less than an hour ago." Elena, despite her condition, managed to speak clearly. "Doctor, I've been having severe chest pain for the past 4 hours. It's radiating down my left arm and into my jaw. I feel nauseated and dizzy. These were textbook symptoms of a heart attack, symptoms that any first-year medical student would recognize." Dr. Blackwood's face began to pale as he realized the magnitude of his error. "Why didn't you mention this during my examination?" he asked, his voice defensive. Elena's eyes met his with surprising strength. "I did. You told me it was anxiety." Margaret continued her assessment, her movements quick and efficient. "We need to get her to the cardiac cath lab immediately. This looks like an inferior wall MI." Dr. Blackwood grabbed the chart, scanning the notes that Margaret had been meticulously keeping throughout Elena's stay. Every symptom was documented, every vital sign recorded, every concern noted. The evidence of Elena's deteriorating condition was there in black and white, a paper trail that showed exactly when the symptoms had started and how they had progressed. More disturbing was the realization that Margaret's assessment was absolutely correct. This was a massive heart attack, and every minute of delay was potentially fatal. "Call cardiology Dr. Blackwood ordered, but his voice lacked its earlier authority. "Already done," Margaret replied calmly. "Dr. Patterson is on his way down. I've also alerted the cath lab and started the cardiac protocol." Dr. Blackwood stared at her. In the time it had taken him to review the chart and process the situation, Margaret had already initiated all the appropriate emergency procedures. Her decades of experience were showing in ways that made his earlier criticism look not just wrong, but dangerously incompetent. Dr. Patterson, the chief of cardiology, burst through the door followed by his team. He took one look at the monitor readings and began barking orders. "How long has she been symptomatic?" he asked, taking charge of the situation with the authority of someone who dealt with these emergencies daily. "Approximately 4 hours," Margaret replied. Symptoms began with mild chest discomfort that has progressed to severe pain with radiation to the left arm and jaw. She's also experiencing nausea, diaphoresis, and shows signs of cardiogenic shock. Dr. Patterson nodded grimly. "Classic presentation. Good catch, nurse. A few more minutes, and we might have been looking at cardiac arrest." Margaret felt a flush of professional satisfaction, the first she had experienced in years. But her focus remained on Elena, who was now being prepared for immediate transport to the cardiac catheterization lab. As the team worked to stabilize Elena for transport, Dr. Patterson turned to Dr. Blackwood. "What was the initial assessment?" Dr. Blackwood's silence spoke volumes. Dr. Patterson's eyes narrowed as he looked between the emergency room doctor and the detailed notes in Margaret's handwriting. "These symptoms were documented 3 hours ago," Dr. Patterson observed. "Why wasn't cardiology called then?" Margaret watched as Dr. Blackwood struggled to find an answer that wouldn't end his career. But Elena, despite being loaded onto a transport gurney, managed to speak. "The doctor told me it was anxiety," she said clearly. "He said women my age often mistake indigestion for heart problems." The silence in the room was deafening. Every medical professional present understood the implications. A patient presenting with classic cardiac symptoms had been dismissed, had nearly died, because of a doctor's arrogance and prejudice. As Elena was wheeled toward the cardiac cath lab, she caught Margaret's hand. "Come with me," she said. "I trust you." Margaret looked uncertainly at Dr. Blackwood, who was staring at the floor in what appeared to be shock. Dr. Patterson made the decision for them. "Margaret, you've been managing this case from the beginning. I want you in the cath lab." As they rushed down the hallway, Margaret couldn't help but think about how dramatically the morning had changed. An hour ago, she had been publicly humiliated, treated like an incompetent old woman who didn't understand modern medicine. Now she was being recognized by the chief of cardiology for potentially saving a patient's life. But as they approached the cardiac cath lab, she realized that the real revelations were still to come. The cardiac catheterization lab hummed with controlled urgency as Elena was transferred to the procedure table. The room was filled with monitors, imaging equipment, and the quiet efficiency of a team that had performed this life-saving procedure hundreds of times. Margaret found herself in an unusual position. Typically, emergency room nurses didn't accompany patients to specialized procedures. But Dr. Patterson had insisted, recognizing that her familiarity with Elena's case and her obvious competence made her an asset to the team. "Margaret," Dr. Patterson said as he scrubbed in, "I want you to monitor her vitals and communicate any changes immediately. Your assessment in the ER was textbook perfect. I need that same attention to detail in here." Elena, despite being sedated, was still conscious enough to follow the conversation. She caught Margaret's eye and squeezed her hand weakly. "Don't let me die before I fix this," Elena whispered. Margaret leaned closer. "Fix what? What happened to you? What's still happening to nurses every day in hospitals like this one?" Before Margaret could respond, Dr. Patterson called for everyone's attention. "We're going in. What we're seeing on the angiogram is a complete blockage of the right coronary artery. This is why she was showing signs of an inferior wall MI." The procedure began with the careful insertion of a catheter through Elena's femoral artery. On the monitors surrounding them, everyone could see the real-time images of Elena's coronary arteries. The blockage was massive, a blood clot that had completely cut off circulation to a significant portion of her heart muscle. Time is critical here, Dr. Patterson explained to the team. Every minute of delay means more heart muscle death. Margaret, how long did you estimate she was symptomatic before diagnosis? Margaret checked her notes. Approximately 4 hours from onset of symptoms to correct diagnosis. Dr. Patterson's jaw tightened. 4 hours. That's pushing the outside edge of the therapeutic window. What he didn't say, but everyone in the room understood, was that if Elena had been properly diagnosed when she first arrived at the hospital, her chances would have been significantly better. The delay caused by Dr. Blackwood's misdiagnosis could have cost Elena her life. As the procedure continued, Margaret found herself in a strange position of being both observer and participant. Dr. Patterson continued to rely on her assessments, asking for her input on Elena's vital signs and overall condition in a way that demonstrated respect for her clinical judgment. Margaret, what are you seeing in terms of her cardiac output? Dr. Patterson asked as he worked to position the stent. Margaret studied the monitors carefully. Blood pressure is stabilizing at 110/70. Heart rate is regular at 72, and her color is improving. The ST elevation is resolving on the monitor. Excellent. The stent is in place and blood flow is restored. Elena's improvement was visible almost immediately. The grayish pallor that had marked her skin began to fade, replaced by healthier color. Her breathing became easier, and the pain lines around her eyes relaxed. But even as the medical crisis was resolving, Margaret could see that Elena was still thinking, still planning. When their eyes met, Elena mouthed 2 words, "Not finished." Dr. Patterson completed the procedure with the skill of someone who had saved thousands of lives. As Elena was prepared for transfer to the cardiac intensive care unit, he turned to Margaret with an expression of professional respect. "Outstanding work today, Margaret. Your quick recognition of the symptoms and your thorough documentation probably saved this woman's life." Margaret felt a warmth she hadn't experienced in 15 years. To be recognized for her clinical skills, to have her experience valued rather than dismissed, felt like being welcomed back into the profession she had never really left. But as they prepared to leave the cath lab, Dr. Patterson made a comment that sent chills down Margaret's spine. "It's fortunate that someone with your experience was paying attention. If she had been left in the care of someone less observant." He didn't finish the sentence, but the implication was clear. Elena might have died because of Dr. Blackwood's arrogance and dismissive attitude. And if she had died, if the person whose foundation funded nearly half the hospital's operations had died due to medical negligence, the consequences would have been catastrophic. As Elena was wheeled to the cardiac ICU, she was fully conscious and alert. She caught Margaret's hand as they moved through the corridors. "Is Dr. Blackwood still on duty?" she asked quietly. Margaret nodded. Elena's smile was grim, but satisfied. "Good. I wanted to be here when I make my phone calls." The cardiac intensive care unit at St. Catherine's was quiet in the way that only intensive care units could be, filled with the constant sounds of life support equipment, monitoring devices, and the soft voices of nurses checking on their critically ill patients. Elena's room was private, befitting her condition, but also affording her the privacy she would need for what came next. Margaret had been assigned as Elena's primary nurse, a decision made by the ICU supervisor who had heard about her exceptional work during the crisis. For the first time in 15 years, Margaret felt like she was exactly where she belonged. Elena was sitting up in bed, looking remarkably well for someone who had suffered a massive heart attack just hours earlier. Modern cardiac intervention had saved her life, but Margaret knew that her recovery would take time. What Elena was planning, however, apparently could not wait. "Margaret," Elena said, reaching for her phone, "I want you to stay here while I make these calls. You need to hear this." Elena dialed a number from memory. The call was answered on the second ring. "David? It's Elena Rodriguez Martinez." "Yes, I'm fine, thank you. Listen, I need you to pull all the financial records for St. Catherine's Medical Center immediately. No, not for an audit, for a reorganization." Margaret watched, fascinated, as Elena transformed from patient to corporate executive. Her voice carried the authority of someone accustomed to making decisions that affected thousands of people. I want a complete review of all administrative salaries, particularly in the emergency department. I also want detailed records of any complaints filed against medical staff in the past 5 years. Yes, all of them. And David? I want this done today. Elena ended the call and immediately dialed another number. Jennifer? It's Elena. I need you to put together a comprehensive report on nursing retention and satisfaction at all hospitals funded by the Foundation. Yes, I know it's Sunday. This is priority 1. A third call followed quickly. Michael? Elena Rodriguez Martinez. I need you to draft a new set of requirements for all hospital administrators who receive Foundation funding. Specifically, I want mandatory training on workplace harassment, age discrimination, and professional respect. No, this isn't theoretical. This is happening immediately. Margaret listened in amazement as Elena made call after call, each one setting in motion a series of actions that would fundamentally change how St. Catherine's operated. But she was only beginning to understand the scope of what Elena was planning. One more call, Elena said, her eyes meeting Margaret's. This one is personal. She dialed a number and waited. When the call was answered, her voice became warm and loving. Jake, it's Grandma. I'm fine, sweetheart, but I need you to do something for me. Remember the nurse I told you about? The one who saved your life when you were 12. Elena paused, listening to her grandson's response. She's here, Jake. She's been working at this hospital for months, and today she saved my life just like she saved yours. No, she's been treated terribly, humiliated by doctors who don't understand what real nursing looks like. Another pause. I want you to come here. Today, I want you to meet her again, and I want the staff here to understand exactly who they've been mistreating. Yes, bring your credentials. And Jake, bring the letter you wrote her when you graduated medical school. The one you never got to send. Elena ended the call and turned to Margaret, who was staring at her in confusion. What letter? Margaret asked. The one he wrote to thank you for inspiring him to become a doctor. The one he couldn't send because you had disappeared after that business with the falsified records. Margaret felt tears in her eyes again. He became a doctor because of me. He says you taught him that medicine is about fighting for people, about never giving up, about seeing patients as human beings instead of diagnoses. He's graduating from his residency next month. He's going to be the kind of doctor you would be proud of. Before Margaret could respond, there was a knock at the door. Dr. Blackwood entered hesitantly, his earlier arrogance completely gone. Mrs. Rodriguez, he said quietly, I wanted to check on your condition and to apologize for my earlier assessment. Elena looked at him with the expression of someone evaluating a particularly disappointing business proposal. Dr. Blackwood, she said formally, please sit down. We need to talk. Dr. Blackwood sat in the chair beside Elena's bed like a man facing a firing squad. His earlier confidence had evaporated completely, replaced by the growing realization that his career was hanging in the balance. Elena studied him with the calculating gaze of someone who had spent decades evaluating people and finding most of them wanting. Dr. Blackwood, she began, her voice calm but carrying unmistakable authority. Do you know who I am? Mrs. Rodriguez, he replied uncertainly. You're a patient who... Elena Rodriguez Martinez, she interrupted, chairman of the Rodriguez Foundation, primary funding source for this hospital's research wing, cardiac unit, and approximately 40% of your annual operating budget. Dr. Blackwood's face went white. Margaret watched as the full implications of the morning's events hit him like a physical blow. More importantly, Elena continued, I'm the grandmother of a young man whose life was saved 15 years ago by the nurse you humiliated in front of your colleagues today. She gestured toward Margaret, who was checking Elena's for with professional efficiency despite the emotional weight of the conversation. Margaret Shun is one of the most skilled nurses I have ever encountered. She has forgotten more about patient care than you will ever learn. Today, she correctly diagnosed my condition while you dismissed it as anxiety. Today, her clinical expertise saved my life while your arrogance nearly killed me. Dr. Blackwood opened his mouth to speak, but Elena held up a hand for silence. I'm not finished. In the past 4 hours, I have made several phone calls. By tomorrow morning, every hospital that receives funding from my foundation will be operating under new guidelines regarding the treatment of nursing staff. There will be mandatory training on professional respect, workplace harassment, and age discrimination. Elena's voice grew harder. More specifically, there will be immediate consequences for any physician who treats nurses as servants rather than colleagues. Mrs. Martinez, Dr. Blackwood began, his voice shaking, I apologize for— Your apology is noted but insufficient, Elena replied. You see, Dr. Blackwood, I believe in accountability. When someone makes a mistake that could have cost a human life, there must be consequences. Margaret found herself holding her breath. She had never seen anyone confront a doctor with such absolute authority. Elena reached for her phone again. I'm calling Dr. Harrison, the chief of staff, to discuss your future at this hospital. As Elena made the call, Dr. Blackwood turned to Margaret with desperate eyes. Margaret, I'm sorry, he whispered. I was wrong. Your assessment was perfect, and I nearly killed a patient because of my pride. Margaret looked at him with a mixture of pity and sadness. Dr. Blackwood, the problem isn't that you made one mistake. The problem is that you treated me like I was invisible, like my 40 years of experience meant nothing. You humiliated me in front of colleagues and students, and you did it because you could. I know, he said quietly. I know, and I'm sorry. Elena ended her call and looked at both of them. Dr. Harrison will be here shortly. Dr. Blackwood, I suggest you spend the time between now and then thinking about whether medicine is really the right profession for someone who values ego over patient care. There was a knock at the door. A young man in medical scrubs entered. He was tall, with kind eyes and a smile that lit up his entire face when he saw Elena. Grandma, he said, rushing to her bedside. Are you okay? I'm fine, sweetheart, Elena replied, her voice warm with love. Jake, I want you to meet someone very special. Jake turned toward Margaret, and she saw in his face the same intelligence and compassion that had made him such a remarkable patient 15 years ago. He was no longer the frightened 12-year-old fighting for his life, but the echo of that child was still there in his eyes. Margaret Chun, he said softly, the nurse who saved my life. Margaret felt her world shift. Standing before her was living proof that her work mattered, that the profession she had devoted her life to could change the world one patient at a time. Jake reached into his pocket and pulled out an envelope, worn from being carried for years. I wrote this when I graduated medical school, he said, handing it to her. I never got to send it because I couldn't find you, but I've carried it ever since, hoping someday I would get the chance. Margaret opened the envelope with trembling hands and read the letter inside. It was a testament to the impact one nurse,